Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today, we're talking with Dr. Megan Brown of Hamilton Physician Group-Catoosa Campus. Thank you for joining us, Dr. Brown.
Thank you for having me.
Dr. Brown is a board-certified family medicine physician at the Hamilton Physician Group-Catoosa Campus. They're located at 45 College Park Drive next to Zaxby's on Alabama Highway in Ringgold. She treats illnesses and injuries and performs preventative care. Dr. Brown, how long have you been with Hamilton?
I've been with Hamilton for a little over 2 years now. Prior to that, I was in my residency training in Chattanooga, and I'm from the area. I'm from Rock Spring, Georgia, so I've always been a part of this community in North Georgia.
Well, that's very nice. Being a part of North Georgia, I bet you have a lot of patients that you know.
I do.
Isn't that great?
It is. It is a good dynamic to already have kind of a personal understanding of someone. Helps you understand their health better, I think.
I'll bet it does. And sometimes I bet it's a surprise when they come in and you say, I haven't seen you in forever.
Exactly.
It's great to see you, and
Yes.
you have a lot of friends. Well, that's good. How long have you lived in this area?
So I was born here, born and raised.
Wow.
So I went to Lafayette High School. I went to the University of Georgia for my undergraduate training, and then I went to Mercer for med school. So I'm a Georgia girl through and through.
I think that's wonderful.
Yeah.
That is wonderful news. I know it's hard to find spare time as busy as you are, but in your spare time, what are some of the things you enjoy doing?
In my spare time, my husband and I like to spend a lot of time outside. We've both taken up mountain biking recently, so we like to do that, or just take our dog out on hikes. We used to go to a lot of concerts pre-COVID, but
Right.
Since that, we're mostly spending a lot of time outdoors and spending time with our family who live here also.
Now, when it comes to concerts, what's some of the music that you like?
Oh, we like all different kinds of music. We like to go to some of the outdoor music festivals. There's a new one here in Chattanooga, Moon River, that's been going on for a couple years that we enjoy. So we like all different kinds.
Is this a lot of local bands?
Sure,
Okay.
some local.
Oh, that's great. That's
Yeah.
nice. What kind of dog do you have?
We have a miniature golden doodle named Ollie.
Golden Doodle.
Yes.
Is that a golden retriever and a poodle?
Yes, it is.
A golden doodle. Oh, and what's his name?
Ollie.
Ollie.
Yes.
It's a little boy.
Yes.
That's great. Ollie. Well, that is, how old's Ollie?
He just turned 4.
Wow.
And he is,
So he's full grown now.
He's full grown. He's still,
How big is a golden doodle?
Well, he's a miniature, so he's only 30 pounds.
Is that right?
Mm-hmm. Good size for inside, and he doesn't shed, so that's an added bonus.
That's good. I'm glad to hear that. That is wonderful. What made you choose to become a family medicine physician? With all the different things you could have done in medical school, what made you choose to be a family medicine physician?
I was really drawn to family medicine just because of the variety of illnesses that you see and also the variety of ages. And also there's a focus in family medicine on prevention, which is kind of unique. In a lot of other specialties, you focus more on treating disease once you get a disease or an illness. But in family medicine, we're lucky to be able to help patients prevent the disease before it happens. So I really enjoy that aspect of it, just trying to help people live healthier lives so that they can actually avoid disease in the future.
Right. I understand. That's very important. What is your favorite part of the job?
So aside from the prevention, it's also really neat to just be able to treat the entire family. We treat from ages 2 to 102. So you get to know people and you get to know their whole families. You can really see how that aspect affects their health. And you get to see them go through different phases of life. I get to see babies grow up and hopefully treat them as adolescents and even adults. So that's a really neat aspect of care.
I think that's wonderful. You get real close to your patients.
Exactly.
I'm sure that you do. Tell us some things about Hamilton Physician Group, the Catoosa Campus, where you are.
So our campus houses 5 different physician practices. We have our primary care, which is what I primarily take part in. And then we also have our convenient care. We have the endocrinology center. We have neurosurgery and spine. And then we also have behavioral health. So I'll speak more about the primary care since that's the part that I do, and also the convenient care services that are offered. Both of these practices provide personalized medical care to adults and children. As I stated before, we see ages 2 and up. The convenient care practices within our same building, and they offer walk-in care with no appointment and even evening and weekend hours, which is nice. We treat, mild illnesses like sore throat, earache, cold and flu, sinus issues, allergies, which is a really big issue right now, especially. And we can also stitch lacerations. We can take care of musculoskeletal issues like strains and sprains. And as I mentioned before, we do a lot of preventive care. So we do annual physicals. We can get people their flu shots, pneumonia shots, tetanus shots, get them set up for their colonoscopies and their mammograms. And we manage a lot of chronic conditions like diabetes, hypertension, thyroid disorders.
My goodness, you guys cover it all.
We sure do. We try.
That is something. How are you on diabetes?
Pretty good.
That's good.
Yeah.
Because I have diabetes, and we've talked about it on Health for Life on some different shows, and I have diabetes, and so I have learned a lot about diabetes since I became a patient over at Hamilton, and I think it's wonderful because you guys are so good with so many different things, and diabetes is close to me, so y'all are so good with the diabetes.
Yeah, and that's the nice thing about family medicine is we are trained in all areas of of medicine. Mm-hmm. So we can treat most things, and if we can't, we can refer you to the appropriate specialist. As I said, we do have the endocrinologist there. So if it's a more complicated case, then we can always refer you to them.
Well, we've got a lot we want to talk about today. Thank you so much for being guest with us, Dr. Brown. Health for Life, we'll be right back. We're going to take a quick break. Don't go away.
Caring like a family. Fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates.
We're back with Dr. Brown. Thank you for joining us, Dr. Brown, on Health for Life. And you're at the Hamilton Physician Group-Catoosa Campus, correct?
That is correct.
Yeah, tell me about, now I love the name Convenient Care. That is just, it's convenient, and it's so cool. Tell me, why is Convenient Care so convenient? Why is it so convenient?
Sure. So it's convenient because you don't need an appointment, and we can treat a lot of things that are urgent, and so you can avoid going to the emergency room. That's the goal, is to help patients prevent a trip to the emergency room, which is going to be much, much costlier. So it's a big money saver. Also, we're open after hours, and we're also open on the weekends. So that's really nice for patients. They can walk in at any time after work or on the weekends. We have x-ray in-house. So if you fall and think you might have a broken bone, we can tell you right there on the spot. And it's convenient also because we take most insurance plans, including Medicare and Medicaid, and we have multiple locations. So I'm in the Ringgold location, but we also have locations in Dalton, Varnell, and Chatsworth. Wow,
so lots of locations, convenient hours, open after hours, and weekends.
Exactly.
Wow, that is fantastic. So I love the name for Convenient Care. You're a family medicine physician. Tell me, what exactly is a family physician?
So family medicine is a medical specialty that focuses on the overall health of people and their families, as the name implies. Mm-hmm. Family doctors care for people and their families over long periods of time, as I mentioned earlier. So you're kind of the patient's primary contact with the healthcare system. If they need a referral somewhere, you can get them to the correct specialist that they need to see, but you're kind of the middleman, just making sure that all the tasks get done. The patient sees all the different doctors they need to see, make sure that the doctors are communicating with each other. And also, as I mentioned before, we focus on preventive health care. That's a huge part of family medicine, trying to keep people healthy so that they don't need all of these other tests and specialists and things of that nature.
A lot of people wish they would have listened. A lot of older people wish they would have listened in their younger years, and that's what you're here to do, help.
Yes, exactly.
And that's wonderful. Treating the whole family, that's got to have a lot of advantages.
It does. You get to know different families and their family history. So if heart disease or a specific kind of cancer runs in a family, to look for those things in the younger generations as they come along. If someone is diagnosed with a viral illness like flu or COVID, you are aware of those exposures and how to treat their family members. And also the thing that I've noticed that is really helpful for families is they can all go to one place. So instead of a mom taking her 5-year-old and her mother to 2 different doctors, they can all come together. So that eliminates trips to the doctor's offices, and it just makes it more convenient.
Oh, that is wonderful. That is absolutely great. With plenty of locations, after hours, weekend hours, it'll save a trip to the emergency room. That is wonderful. One of the things that is important is an annual physical. Why is it so important? Because sometimes you forget to schedule it. Why is an annual physical so important?
Yeah, it's very important, and it can help to kind of try to get it at the same time each year and around the same month each year. And they're really important because you can find a problem before it starts. For instance, if we get you scheduled for your screening colonoscopy, you can find a colon cancer before it turns into a colon cancer and actually remove it. So there are a lot medicine has come a long way in terms of screening, and there are a lot of diseases that we can actually prevent by having people come in yearly and get their age-appropriate screenings, not only tests like colonoscopy, but also lab work, checking cholesterol to assess for the risk of heart disease and other things like that you can prevent. 25% of Americans actually don't have a primary care physician. And so for those that don't, I would really encourage them to find a primary care physician that they can trust and that will listen to them and their concerns and get them the care that they need.
And you can take care of that for them.
Absolutely.
They can come in and see with those extended hours and weekend hours. It is so important that folks have that annual physical and they're able to do those tests that they need to do. You say age-appropriate test, younger, older. And what about immunization?
Immunizations or vaccinations.
A vaccination for young people. That's important.
Very important, yes. And, there are vaccinations, of course, for children, and there are also adult vaccinations like tetanus, flu, pneumonia, shingles. So, and all of those are recommended at different ages. Different groups have different risks. So we can get you set up with all the appropriate vaccinations that you need and other screening tests that would be appropriate.
Okay, I understand. I want to talk about the flu vaccine in just a few minutes. Can we do that?
Sounds good.
All right, that'll be fine. We'll do that. You're on Health for Life. Dr. Brown is my guest from the Hamilton Physician Group-Catoosa Campus, and we'll be right back. Stay here.
If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
We're back. Thanks for listening to Health for Life. We're talking with Dr. Brown, Hamilton Physician Group-Catoosa Campus. Convenient care. I love the name. That's what we're talking about. And flu shots. Now, flu shots are so important to so many people. Should we get a flu shot this year?
Absolutely. Getting your flu shot is even more important this year than usual. It is a safe, inexpensive way to stay healthy. The flu vaccine significantly lowers risk of heart attack and stroke even among certain groups. At last flu season, there were between 24,000 and 62,000 deaths from flu in the United States, with elderly, young children, and pregnant women at higher risk. And not only does the flu shot reduce the odds of getting sick, it often means a less severe illness. So a common question I get from my patients is, well, why should I get a flu shot when I got one before and I still got the flu? But what we have really found in our practice is that on the rare occasions that does happen, when a person gets the flu after a flu shot, they really do get a much milder course of disease as opposed to someone who hasn't had a vaccination at all. Also, now with coronavirus, that makes things a lot more complicated. So coronavirus and influenza can have very similar symptoms. And so it can make it easier to kind of figure out what's going on if you're sick. If you've had a flu shot, it helps eliminate that risk from the flu. We found, earlier this year that people can actually get COVID and flu at the same time.
Ooh.
So you definitely want to decrease your risk for getting the flu since we do have a vaccine for that.
Do have a vaccine for the flu. Mm-hmm. And if you take the flu shot, you get the vaccine and you end up getting the flu, because some people have done that, a lot better chance that the flu will be much more mild.
Exactly.
Yeah, that is great. I'm glad to hear that. And some people do get the flu after they get the flu shot, but they don't get the flu because of the flu shot.
Exactly. So the flu shots that we use are an inactivated virus, which means it cannot actually give you the virus.
So many people believe.
Yeah, and I think the reason that patients believe that is because some people will have a reaction to the flu shot. I mean, you think about kids who get their shots when they're little, and they often will get a fever that day. They'll get kind of achy. They just don't feel good. Babies might be a little whiny, and parents expect that on the day they get their shots, and they give them a little Tylenol. They're better the next day. We see that same thing in adults who get vaccinations. So when you get the flu shot, if you get that reaction, if you get a mild fever, if you feel kind of achy and just don't feel good for a few hours or a day even, that's just a side effect of getting a vaccination, just like little kids getting their vaccinations, but it is not causing the flu.
Good. Way to go. Glad to hear that. That's important that people know that. COVID-19 might be keeping some folks from going and visiting a healthcare professional. What would you say to someone who wants to come to Convenient Care Catoosa, but they're afraid when they get there, they might contract COVID-19?
I would tell them that we're following the CDC guidelines, and we put a lot of processes in place to keep our patients safe. So, of course, everyone in our office is wearing face masks, and we're also having the patients who come into our office wear face masks, and we provide them with a mask if they don't have one already. We use other protective equipment such as gowns and gloves and goggles when necessary. We're enforcing social distancing between ourselves and also between our patients. We have sanitizing stations throughout the office, and we've staggered the appointment times to minimize the number of people in each area. In addition to all these practices, we're also keeping the sick patients separate from the well patients. So there will not be any sick patients in the waiting room with you. In fact, we try to limit any waiting time at all. We try to bring the patients straight from the front door back to their own room where they can close the door and be in the rooms by themselves, just to eliminate any potential risk.
And a lot of cleaning, I'm sure, around the office,
Absolutely.
and everything is kept clean. Delaying medical care, that can be dangerous, correct?
Yeah, absolutely. I mean, we talked a lot about preventive health care and screening for cancers and heart disease. And unfortunately, during this time, because people are scared to go to the doctor, I believe that there are a lot of cancers and a lot of heart disease and other chronic conditions that are going undiagnosed. So, if this were something that were over in a couple of months, that's definitely understandable to wait. But as we have seen, this has been a much longer course. I think that, if you've been putting it off, now's the time to get back in with your primary care physician because you don't want those diseases to go undiagnosed.
Well, one of the things that a lot of us have never been exposed to, and I'm one, I have never had anything to do with telehealth until recently. Tell me about telehealth. How does that work? What is telehealth exactly?
Yeah, so telehealth is new to everyone, not just you, but to us physicians as well, a lot of us. But it's a really great alternative, and it's easier than most people think. We can use it for primary care and convenient care both. And you use your smartphone, your tablet, or your computer, and you can have a face-to-face visit with your healthcare provider from your home or wherever you are. I've had people out in the store when I called them for their telehealth visit.
Oh, they're at the grocery store?
Which I wouldn't recommend, by the way, but it has happened.
I'm sure, yes.
And it's covered by health insurance, just like an in-person visit. And as I mentioned before, Hamilton accepts most health insurance plans as well as self-pay.
Well, that's good. That is very good. It's interesting. What if I had an earache? If I had an earache and I called to schedule a telehealth appointment, what should I expect?
Yeah. So after you schedule your appointment, we will either email or text you a link to the meeting. And literally all you have to do is click on that link and a video screen will appear. You and your healthcare provider will talk about what you're experiencing and come up with a plan. If we prescribe a medication, it will be sent electronically to your pharmacy. And if you do end up needing lab tests or x-rays, then we'll ask you to come into our office for that. But in a lot of cases, these things can be taken care of with just a conversation about symptoms. And so for people who are concerned and still don't want to come into the office with all of the precautions that are being taken, telehealth is a great option.
Do you think telehealth will be around after COVID-19?
I think that it definitely will. I think that it's one of the benefits that we've seen is that we're all thinking about different ways to practice medicine. And I think that this is a very useful tool for lots of situations.
Wow, that is something good because that is brand new to everybody.
Yes.
Brand new to everyone. Dr. Brown's with us. You're on Health for Life. Dr. Brown is at Hamilton Physician Group-Catoosa Convenient Care. Very convenient. You can get a visit after hours, weekends. It's just fabulous, and a very good alternative to going to the emergency room. We've got more of the Dr. Brown coming up next. Hold on. Thanks for listening.
Caring like a family, fighting like an army. Hamilton Healthcare System is here for you. Armed with a love for our community, advanced care, and personalized service, our commitment to serve with compassion stands strong in this season of uncertainty. You are the heart of all we do. Visit us at hamiltonhealth.com for timely health information and updates. If you're in need of medical care, don't delay. Your health won't wait. Hamilton Medical Center is ready to care for you. We are following CDC guidelines. Patients and guests are screened for COVID-19 symptoms. Those who are suspected to have the virus are treated in a separate area. Plus, Hamilton's high-powered UV light robots eliminate 99.9% of bacteria and viruses on surfaces. Please do not delay medical care. Your health won't wait. As always, Hamilton is here for you.
Thanks for listening to Health for Life. We have Dr. Brown in the studio, Hamilton Physician Group-Catoosa Campus, Convenient Care. Dr. Brown, great to have you here. A couple more questions before I let you go. It is important to find the right primary care provider for you. What do you think is a good way to choose a primary care provider?
Yeah, I think it's a very good question. It's very important to choose the right primary care provider because when you can work as a team with someone, you'll just get better health care. I think you should look for a doctor who listens to your concerns, listens to your questions, encourages you to ask questions. You need to find a primary care physician who's going to take the time to explain things to you. It's obviously an added bonus if they're experienced and board certified, and takes your health insurance. Check with your insurance to see which physicians are included And we, as mentioned previously, accept most insurance plans, including Medicare and Medicaid. If you're not sure, you can always just give us a call and we'll be able to help you out with that. Also, finding someone who's close to home or your work, just somewhere that's going to be convenient so it doesn't take you a long time to get there and take a big chunk out of your day, because that can be really frustrating.
Well, I'm sure you're right about that. Now, I do have a quick question for you, because let's say, for instance, I have a primary care provider and it's not at convenient care, but it's after hours. Can I come see you because I couldn't go to my primary provider, and then maybe you send them the information they need to know?
Absolutely. And that's the nice thing about our office. We do function as both a primary care and a convenient care. So we do see a lot of patients who have a different primary care provider, but because they're not open on the weekends or after hours, they'll come see us for urgent concerns that come up, and we definitely try and communicate with their primary care providers just to make sure that all of our patients are getting good care and that everyone's on the same page.
That's great. That's fantastic. Now, if I want an annual physical, if I'm thinking it's time for my annual physical, before I go see you, is there anything I need to do, anything special I need to do, anything when it comes to my diet, or is there anything I need to do before I come visit for my annual physical?
Yeah, there are a few things that you can do just so you make the most of your time with the physician, because we're often on a tight schedule, so being prepared is good. You want to review your family medical history. Think about different disease processes that run in your family, like certain cancers, heart disease, diabetes, hypertension. Those things are going to be important for your physician to know. You also want to find out if you know, and you may not, that's fine. Your doctor will know, but find out if you're due for any general screenings or any vaccinations. If you think you've had, say, the pneumonia shot, but you're not sure when it was, if you can find out when those things were done, that would be really helpful. And then write down a list of issues or questions. So many times people get to the appointment and they say, I had something that I wanted to ask you, but now I'm here and I can't remember it. So it's always good to have a list so that you can make sure that you get all of your questions answered.
Well, that is fantastic. If I step on a rusty nail, I can come get a tetanus shot.
Absolutely.
You get a lot of that?
We do. Stepped on a nail or sliced my finger in the kitchen. The interesting thing about tetanus shot, too, is one formulation of the tetanus shot, the Tdap, it actually includes the vaccination for whooping cough. So it not only will prevent you from tetanus, but will also prevent your babies and your grandbabies from getting whooping cough. So that's a really nice added bonus.
That is. I had no idea about that. And earlier we talked about stitches. If somebody cuts themselves and needs stitches, you do that kind of work too.
We do. We can stitch people, and if they get stitched somewhere else and they need the stitches removed, we can do that too.
Really?
Yes, sir.
It's like a one-stop shop. As a family medicine physician, tell me about some of the services that you have for women.
Yes, so in addition to our regular primary care services, we provide women with care that they may be used to getting from a gynecologist. For instance, I do a lot of pap smears to screen for cervical cancer. We can also prescribe birth control. The nice thing about family medicine is we are trained in so many different fields. So not only women's health, but we're trained in, for instance, psychiatry. So we do a lot of mental health, and we always have those specialists available. So if it gets to a point where it's a complicated case and you need a referral, we can do that. But family medicine really covers the spectrum. So women's health, psychiatry, and all different forms of medication we can provide.
No idea that you went into mental health also. Absolutely.
It's a very important part of just overall well-being. So it's really important that patients are paying attention to that along with their physical health.
That is very important. A lot of information today. Thank you so much for being a guest with us here on Health for Life. If you could leave our listeners with one word of advice, what would that be?
I would just reinforce this idea that although, unfortunately, we are in the middle of a pandemic, I would not delay your care. This is going to be an important part of staying healthy and making sure you don't get the virus actually is just staying on top of your preventive health care and following up with your primary care doctor. So don't delay. Go see your doctor.
Sounds great. Thank you so much. For more information about Hamilton Physician Group-Catoosa Campus, call 706-965-4060. 706-965-4060 or visit hamiltonhealth.com/Catoosa. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.